My lecture this evening is titled, Can CGM Reduce the Risk of Fasting? And the roadmap of my presentation is to go over safety of fasting in type 1 diabetes, glucose profile during fasting, the month of Ramadan, effect of CGM on glucose profile in type 1 diabetes in general, and then benefits of CGM during fasting, and ends that with recommendations. I'm going to start in a format of questions and answers and then conclusion. So the first question, can patients with type 1 diabetes fast during the month of Ramadan? Maybe 15 to 20 years ago, this question used to be highly debatable, but numerous studies in the past 10 to 15 years in adolescents and adults have shown consistent findings. I am showing in this slide several studies from the different countries that all have shown consistently that adolescents with type 1 diabetes can fast the month of Ramadan without major complications. And what they meant with major complications generally are decay, severe hypoglycemia, hospitalizations, or ER visits. Similarly, studies in adults with type 1 diabetes showed that not only patients with type 1 diabetes can fast the month of Ramadan, but they might also have favorable outcome in reducing hypoglycemia or improving HbA1c. So diabetes and Ramadan guideline in 2021 has stated clearly in their publication that both adolescents and adults can achieve safe fasting during Ramadan with no worse outcome than prior to Ramadan, and basically endorsement of the findings of those numerous studies. However, we all remember that the landmark study of EPDR have indicated clearly that Ramadan fasting for type 1 diabetes increases the risk of hypoglycemia and decay. And I believe that the discrepancy between the findings of the EPDR study and the recent study in the past 10 years or so is due to multiple factors shown in this table, that the insulin regimen was different between the 2004 and recent years. The type of insulin became different from NPH and regular in the old days to using insulin analog almost exclusively in the recent years. The source of information in the EPDR study was a patient-filled questionnaire, while it is a directly obtained information from the investigator in most of the recent study. And the glucose monitoring was based on infrequent SMBG in the EPDR study, while most of the recent study have used the CGM or the intermittently scanned CGM or flash monitoring and more frequent SMBG. So I believe given all these changes in the past 5 to 10 years, it's fair to say that the findings of the EPDR study regarding type 1 diabetes and fasting in Ramadan cannot be applicable in the newer and different settings that we have nowadays for our patients. So the conclusion number one is patients with type 1 diabetes can fast the month of Ramadan without increasing the risk of major complications. Okay, this brings us to the second question. How does glucose profile look like during fasting in patients with type 1 diabetes? And I'm showing you here two results, one from the group of Imperial College in type 2 diabetes patients, and one from my group in Tawam Hospital in type 1 patients. And you can see very similar pattern, which is trend toward hypoglycemia in the last few hours of fasting, followed by sharp increase in glucose level at the iftar time, and then extended hyperglycemia in the post-iftar hours, that's in type 2. Similar decline in the last hour or two in type 1 diabetes patients, sharp increase in the hour of iftar, and extended hyperglycemia in the post-iftar hours. And as you can see, there is wide fluctuation between fasting hours and feeding or eating hours in both groups. Similarly, a study in poorly controlled type 1 diabetes who used the flash glucose monitoring showed also that there was wide fluctuation in their glucose profile, but they also added that the hyperglycemia was much more common or prominent than hypoglycemia in those patients. So conclusion number two, there is wide fluctuation during Ramadan fasting, and there is more hyperglycemia than hypoglycemia. Question number 3, does fasting itself increase or create this glucose fluctuations? In another meaning, is glucose fluctuation during fasting and non-fasting the same or it's different? And this was shown clearly in our study from the group in Tawam, a cohort of adolescents who fasted the month of Ramadan, and they all used the CGM, were also studied in the month before or after Ramadan, with the exception of the week of Eid because of the unusual eating pattern. And the CGM profiled that beside the difference in peaks and troughs of hypoglycemia between eatings or between the month of Ramadan and the non-Ramadan time, there was no difference in the mean glucose between the two periods of time. There was no difference in the duration of hypoglycemia per 24 hours, and there was no difference in the duration of hypoglycemia. Again, this is the same cohort who were studied by CGM during Ramadan and non-Ramadan. And that's why we've concluded that adolescents with type 1 diabetes have the same wide fluctuation in interstitial glucose during fasting Ramadan as they do outside Ramadan. So let's summarize now the 3 first conclusions. While we do acknowledge clearly that there is wide glucose fluctuation during fasting the month of Ramadan in type 1 diabetes patients, it is well documented now that those patients can fast without increased risk of high major complications, and that the glucose fluctuation is not worsened by Ramadan fasting. So what is responsible for the glucose fluctuation in diabetic patient? Is it the fasting itself, or is it the fact that they have diabetes that is basically not well controlled and lead to wide fluctuation? I believe it is fair to say that it is the type 1 diabetes itself that induces those fluctuation. It is not the fasting. Because of that, I believe that the title of my lecture, which was "Can CGM Reduce the Risk of Fasting?" is somehow inaccurate or maybe misleading. I believe that if we agree that there is no risk of fasting in type 1 diabetes patient that exceed the risk of diabetes itself, then maybe the title should say, "Can CGM reduce the risk of glucose fluctuation during fasting?" And that takes me to question number 4, which is, can CGM help in Ramadan fasting? Unfortunately, I have searched, and to the best of my knowledge, I could not find any randomized controlled trial that compared CGM versus SMBG in the same cohort with our adult or children, type 1 or type 2, to look at the effect of using CGM versus not using CGM on fasting. And all the reports are basically presumptive, or they are based on non-fasting studies. There is one study from the group in Saudi Arabia, Dr. Al-Agha, who reported a cohort of 51 type 1 diabetes adolescents who used either MDI or insulin pump, and they all used the flash glucose monitoring during fasting Ramadan. He reported that the percentage of days that could not be fasted was 33%. 42% of these days were basically the fast was broken due to hypoglycemia. In his results, hypoglycemia was symptomatic in 90% of his subjects, and 10% of the hypoglycemic episodes were only detected by the use of the flash glucose monitor. And he concluded that severe hypoglycemia was avoided in 10% of the hypoglycemic episodes in type 1 diabetes during Ramadan. However, that study did not have a control group who did not use the CGM to basically make the recommendations stronger. However, it is very reasonable presumptive conclusion. On the other side, we know that the CGM effect on type 1 diabetes patient is very well documented outside the month of Ramadan. And I'm going to show you a few studies with their findings. Here we're showing that CGM reduces HbA1c, while at the same time reduces the mean time in hypoglycemia in a cohort of HbA1c of type 1 diabetes patients who were fairly controlled. Similar study of a better controlled patient with HbA1c below 7%, an age group between children and adults who were basically monitored comparing CGM and SMBG, and they used different criteria. And in all criteria, they showed that the group that used the CGM was able to reduce their HbA1c without having severe hypoglycemia. The same group was more likely to reduce their HbA1c while having the same hypoglycemia, or they were able to reduce the hypoglycemia without worsening of HbA1c. So it doesn't matter which category you look at, the CGM has favorable outcome compared to the SMBG. Many other studies, for the sake of time, will not be able to show them individually. However, they all showed a consistent finding that the use of CGM reduces HbA1c, reduces the incidence of hypoglycemia, shortens the time of hyperglycemia, and improves the quality of life because it reduces the fear of hypoglycemia in patients who are wearing CGM. Furthermore, the use of CGM resulted in reduction in the visits to the emergency room for up to 2.5 years period, comparing the group of patients who used CGM early versus those who used it late. The type 1 diabetes exchange data showed clearly that the feedback from patients about CGM is highly favorable, whether we're talking about the real-time CGM or the retroactive CGM. They all have rated very highly the feature of the CGM by showing the arrows of the direction of blood glucose change, giving the alarm for high or lows, giving the alarm for falling or rising blood sugar, and they all have decided that those features are very helpful in guiding them, adjusting their insulin dose, adjusting their meal, and even adjusting their level of exercise. Lastly, the use of CGM in combination with insulin pump, what is known as the low glucose suspension feature, have been shown to reduce the hypoglycemia during Ramadan, reduce hyperglycemia, and enable patients to fast all the days of Ramadan, according to the study done by our colleague Nancy El-Barbari from Egypt. So if we need to summarize the benefit of CGM in type 1 diabetes in general, not necessarily in Ramadan, but in general, we all can agree that CGM reduces hypoglycemia, it reduces hyperglycemia, it improves HbA1c, it enables patients to fast more days, it prevents severe hypoglycemia, and it does improve the quality of life because it reduces the fear of hypoglycemia. If you think of all these features in any device or any regimen, and then ask yourself, can this be helpful in the month of Ramadan? I believe the answer would be definitely yes. And based on that, I would say that CGM used in type 1 diabetes who plan to fast the month of Ramadan is actually essential if available or affordable, and it is highly recommended. The diabetes and Ramadan guidelines have endorsed the same statement, and they have said in the 2021 guidelines that the use of CGM or flash glucose monitoring is superior to the SMBG monitoring, and it should be the method of choice if feasible. Thank you very much.